Welcome to the Fall 2020 semester in the age of COVID-19. My name is Janica and I'm a University of Hawaii student. Hello! The pandemic has turned 2020 upside down, but it will pass and we'll need our UH education more than ever for life after COVID. But first, we need to get through this semester. I'm going to tell you how the campus has prepared and what will be required of students and everyone who have to come to campus.
Before you leave your home every day, monitor yourself for symptoms. Stay home if you feel sick. This may be the most important tip of them all. When you leave your home, maintain physical distancing of at least 6 feet from others whenever possible. Wear a face covering like a cloth mask, especially when you are unable to maintain a 6-foot distance. Wash your hands frequently and thoroughly with soap and water for at least 20 seconds, or use hand sanitizer, but soap and water are preferred. Avoid touching your face and get a flu shot. It reduces your chances of catching seasonal flu that could be mistaken for COVID-19. It's mandatory for everyone who has to come to campus to use UH's Daily Health Check-in app and receive an all clear from the app before coming onto campus. It's easy and takes less than a minute a day. It will ask the same questions every day on symptoms and possible exposure and is available on the App Store and the Google Play Store. You can also choose to answer the questions via a webpage. First, if you have been on campus and tested positive for COVID-19, come into close contact with someone who tested positive, or were told to quarantine or isolate, stay home and notify your campus. Your campus will announce where positive and suspected cases should be reported. UH schools are working closely with the Hawaii Department of Health. Health officials need to know who to test, isolate those who test positive, contact everyone who may have been exposed, and continue to test and isolate. The university will not publicly disclose the identity of anyone who tests positive. Positive cases reported on campus will be announced via email. It's mandatory to wear a face covering whenever on campus, indoors and out. If you're not wearing a face covering, you will be asked to leave campus. Repeat offenders will face suspension or expulsion. You are not required to wear a face covering while in isolation. For example, if you are working in a room by yourself, or if you have a medical condition or disability where a face mask poses a health or safety risk. Acceptable face masks include cloth masks, 2-ply cotton with loops or ties, cloth bandanas that are 2-ply cotton, and surgical style and dental masks with straps. Plastic face shields are allowed when used in combination with acceptable face masks. N95, N99, and N100 respirators should be reserved for healthcare professionals. Face masks and respirators with exhalation valves are not allowed. They only protect the wearer and do not prevent respiratory droplets from going airborne, like cloth masks do. Be sure to wear your mask correctly. It should always fit snugly and cover your nose and mouth with no gaps between the mask and your face. Wash your hands before and after you put your masks on. Wash your hands frequently and properly. There will be plenty of soap. And there will be hand sanitizer stations at building entrances and in every classroom and lab. Don't touch your face with unwashed hands. Practice safe physical distancing whenever on campus by maintaining at least 6 feet of space from others whenever possible. It will be easier this semester as there are significantly fewer people on campus. Classrooms and labs have been reconfigured to ensure safe physical distancing. That has reduced room capacity by more than 50%. A vast majority of all courses are online in fall 2020, and more than half of the employees who normally work on campus are teleworking from home. There will be daily cleaning and disinfection of public spaces, including classrooms, restrooms, lobbies, and elevators. High-touch surfaces in public areas, including door handles, elevator buttons, faucets, and paper towel dispensers. Any area that may have possibly been infected will be closed off for at least 24 hours before being properly cleaned and disinfected. Please check your email daily for information, including regular updates and reminders. You can also stay informed by regularly checking uhnews.org and UH's social media sites.
Campus life will return to normal, and we'll get through this together. Let's all do our part and follow the mandatory requirements and safety tips. Take care of yourselves and each other, and good luck with this semester.